Okay, so we can go live.
Okay, well, good afternoon, everyone. Today is Monday, November 1st, 2021. We have convened the Board of Health for the New York City Department of Health and Mental Hygiene. It is now 3:04 p.m. and I will call this meeting to order. To begin, I will conduct roll call. Please let me know if you are present by saying yes or here after I say your name, please. Dr. Joel Foreman.
Here.
Dr. Sydney Hankerson.
Here.
Karen Redlener.
Here.
Dr. Lynn Richardson.
Here.
Dr. Mitch Katz. Dr. Simona Kwan.
Here.
Pam Breyer. Rosa Gill. Dr. Sixto Caro.
Here.
And Dr. Susan Klitzman.
Here.
Okay, so I recorded absences for Pamela Breyer, Mitch Katz, and Rosa Gill. I'm just going to check with Lisa, but I believe we have quorum to continue, including on the meeting minutes. Is that correct?
That's correct, Commissioner. Yes.
Wonderful, thank you.
I see
and so
Dr. Katz.
Sorry, Dr. Foreman, say that again.
I see Dr. Katz has joined us.
Oh, okay, thank you so much, Joel. Hi, Mitch. We were just starting with roll call, and thank you for joining. So I'll just mention the list. Dr. Katz here. Just say here, Mitch, for the record, please.
Here.
Thank you so much. Okay, so before we discuss the items on today's agenda, let's start with approval of the minutes from the October 18th meeting. Are there any corrections to the minutes from the meeting?
I found, it's Dr. Foreman, I found a number that I emailed in to Roz Windholz, none of which are terribly substantive.
Okay, thank you so much for sending those in.
Dr. Chakshi, I have just a correction also.
Please go ahead, Karen.
It's on page 70. And though I would like to have edited my remarks more broadly, I just am focusing on the one thing for clarity. On page 70, towards the bottom of the page, the second to the last paragraph, it says partly because they're not so specifically indirectly impacted in often obvious ways. That really should be it should be directly impacted as opposed to indirectly impacted.
Thank you, Karen.
Thank you.
Any other corrections? All right, well,
I was just going to say, I'm sorry, Dr. Chakshi. Maybe I'll just mention the two that actually were substantive, I guess, very quickly. One was page 30. I'm forgetting the line. I'm sorry. It says, the quote is injustice, instructional racism, and I believe we meant structural, not instructional. And then on page 33, line 22, I think the word that we were looking for is exponential, not expediential, which I'm not sure is a word, but exponential increase in, and I think this was in declaring race as a public health emergency.
thank you for those corrections as well.
Oh, and there's one more, I'm sorry, page 62, line 21. It's the word we're looking for is disparately, not desperately. Racism has disparately affected. So the rest were all really just grammatical.
Thank you very much, Dr. Foreman. So we'll proceed with the minutes being so corrected for the change that Ms. Redlener pointed out, as well as Dr. Foreman, the three changes that you pointed out, along with the smaller ones that you've submitted for the record as well. Dr. Klitzman, did you have a correction as well?
Same point as my colleague Karen Redlener, but otherwise substantively okay.
Okay. Any other corrections to the minutes? I'll just pause for one more moment. Okay, since there are no further corrections, may I have a motion to approve the minutes as amended?
So moved.
Thank you, Karen, and a second.
Second.
Thank you, Dr. Richardson. Okay, all those in favor?
Aye.
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 Any opposed? So the minutes from the October 18th meeting are approved as amended. Let's turn to the agenda now. I will start just very briefly by grounding us on the somber note that today we mark over 5 million deaths due to COVID-19 globally, and we're approaching 750,000 deaths, which was the magnitude of the tragic toll of the entire American Civil War here in the United States. And it's why I, and I know all of you as well, are committed to doing everything that we can to prevent further suffering during this pandemic. So today, in that vein, we will be discussing two separate orders regarding COVID-19 vaccination mandates for city employees and certain city contractors. And our presenter is Lisa Landau, General Counsel for the New York City Health Department. And I'm pleased to turn it over to Lisa.
Thank you, Commissioner, and thank you, board members, for convening today. So we're here to talk about the two orders. First, the order regarding full vaccination for city employees and certain contractors. I thought that it would be useful just to step back for a moment to observe the cadence of our vaccine orders, all of which you've been involved with, and of course, ending with today, the order that we're considering, October 20th order requiring COVID vaccination for all city employees. And I think that it's clear from the cadence that we've had a two-pronged strategy of focusing on the city's most vulnerable populations and ensuring vaccination of staff who are dealing with those vulnerable populations, including staff in residential and congregate settings. So referencing our order requiring COVID vaccination or testing back on August 10th, and then moving to a full vaccine requirement for DOE employees who are working, of course, with children who, most of whom or many of whom are not able to be vaccinated quite yet. Then, of course, the other strategy is walking the walk, and the city's leadership in vaccination is important. And we have asked our own agency staff starting in the end of August to be vaccinated or tested. And that has moved forward, but nevertheless, we feel it important to continue to press on vaccination. And so we have the commissioner order of October 20th that we're considering today to require full vaccination for city employees and certain city contractors. Next slide, please. So just to note that these mandates are having the effect that was hoped for, and we have proof of that from the inception. Really, 65% of New York City employees were vaccinated before our first mandates in August. As of mid-October, we increased that to 85% of New York City employees. And then as of today, 91% of New York City employees have been vaccinated, as announced by the mayor this morning. So we've really seen the uptick in the way that we could have anticipated. So the first mandate that you're considering today is the commissioner order dated October 20th, 2021, that requires all city employees provide proof of vaccination by October 29th, that was Friday. And if that did not happen by 5 p.m., today is the day that those employees who did not show that proof would be placed on leave without pay. City agencies contracting for human services are also part of this mandate because they are working, with public-facing environments, and so it makes sense that those entities are also mandating their employees to be vaccinated as well. There is a slender extension of time for DOC uniformed employees, giving them until November 30th. And of course, this order does not include a weekly testing option. This is the full vaccination mandate for New York City employees. And just to note that employees can request accommodation for either religious or medical exemptions. Next slide, please. So rationale is, I think, rationales that you're familiar with: protecting city employees, ensuring a safe workplace, and of course, protecting the public through city workforce vaccination and boosting vaccination rates, especially before the winter months. Just a quick update that the DOE mandate has been upheld by courts in New York City. And we have at least now 2 lawsuits that have been filed against the citywide mandate. Both courts have denied the temporary restraining order. So in the legal realm, these mandates are being upheld by the courts. And this is really happening across the country, not only in New York City. Next slide, please. So as of yesterday, our commissioner signed an additional very slender supplemental mandate that addresses Board of Elections employees and giving them an extension until November 30th to ensure a straightforward and accurate count of our voting. And city agencies that contract for services in locations where human services are provided. So these are folks that include food service workers, security guards that are not human service contractors themselves, but are working in those environments, are also required to be vaccinated and fully vaccinated with no testing option. And temporary workers that work side by side with city employees are also required by this supplemental mandate signed yesterday. And again, this narrow mandate signed yesterday is to ensure that BOE has the staffing necessary for the election process, and the additional group covered under the contractors really to address some gaps, including, as I mentioned, security guards, food service workers, and temp workers who work side by side with our city employees. Next slide. Okay, and at this time we can discuss any questions that you may have before we go to ask that the board ratify each of these orders.
Thank you so much, Lisa, for that clear presentation. And as usual, we'll take questions from the board either by raising your hand virtually on the Zoom function or just physically raising your hand on the screen. Any questions from the board or comments? Dr. Foreman.
Thank you for such an excellent presentation and for, I think, such well-timed orders. I had a general question about the department's intent to require full vaccination as opposed to the first vaccination. And a second question about why the Department of Corrections has been given more time when other departments have not.
Yeah, thank you very much. I'm happy to start on that, and then Lisa will turn it to you to elaborate. On the first question, it's a very important one, and I can give you a straightforward answer, which is that the department's intent is to support full vaccination, meaning a single dose of any vaccine that's authorized by the FDA as a single dose, or both doses of one of the mRNA vaccines that has been authorized by the FDA. The orders that are before us today, as well as the prior orders, all do include that in the language, such that the deadlines that are set forth are for receiving the first dose, but there are provisions to ensure that if a second dose is required, that occurs within 45 days of having received the first dose. So that's on the first one. And then on the second one, maybe I'll turn it to you, Lisa, to answer about the Department of Corrections.
Yes, thank you, Commissioner. I think it was meant to be the extension to really a public health extension, in that there's been, as I'm sure you're aware, understaffing, unfortunately, and concerns that health of the detainees at our detention centers, of course, Rikers being front and center, really need to have as many uniformed officers available as can be made available, because there have been challenges in staffing. So I think with the health of the detainees in front and center in our minds, this short extension of time, really relatively, was made to ensure the health of folks who are in those facilities.
Thank you. It makes sense. It's just obviously these mandates have been very effective. So the sooner they are put in place, the sooner people get vaccinated.
Thank you, Dr. Foreman. Dr. Katz.
I just wanted to add on to what Lisa said, two things. First, I believe, Lisa, that Department of Corrections is requiring that the correctional officers who work at Elmhurst and who work at Bellevue are required to have the vaccination. They did not get an extension. And that was meant to make sure that the correction officers with greatest risk were vaccinated. And then just again to Dr. Foreman, I think has been in the newspaper that key to getting inmates appropriate medical care is having enough correction officers to bring them to medical care. And so it was, if you will, a weighing of different public health goals, and the feeling that an additional month was the best way to achieve both goals.
Thanks, Dr. Katz. Those are important comments to add. Thank you. Other questions or comments from board members? Okay, I'm not seeing any hands raised. So if no further questions, I'll ask for a motion. First, to ratify the October 20th, 2021 order of the commissioner to require COVID-19 vaccination for city employees and certain contractors. This is the first part of what Lisa covered. I'll ask for a motion.
So moved.
Thank you, Dr. Katz, and a second.
Second.
Thanks, Dr. Foreman. I'll now take a vote from each member. Dr. Hankerson.
Yes.
Redlener.
Yes.
Dr. Richardson.
Yes.
Dr. Kwan.
Yes.
Dr. Caro.
Yes.
And Dr. Klitzman.
Yes.
Okay, so with a unanimous vote in favor of the motion carries. And we'll just move directly to the second part of business for our meeting. Again, I'll ask for a motion to ratify the October 31st, 2021 supplemental order of the commissioner to require COVID-19 vaccination for city employees and certain contractors.
So moved.
Thank you.
Second.
And I believe that was Dr. Richardson on the second.
Yes.
Okay. Thank you. And I'll now take a vote from each member. Dr. Foreman,
Yes.
Dr. Hankerson,
Yes.
Dr. Katz,
Yes.
Dr. Kwan,
Yes.
Dr. Caro,
Yes.
and Dr. Klitzman.
Yes.
Thank you so much. Again, with a unanimous vote in favor of the motion, this motion also carries. And that concludes our two items for the agenda today. As I always do, I want to thank each of you for all of your work as we continue to respond to the novel coronavirus and as we take these steps, of course, to protect the health and welfare of New York City. Thanks for making yourselves available for this board meeting, and we will be back in touch soon. I wish everyone health and safety until then. Thank you so much again, and we are now adjourned.
Thank you.
Thank you.
Thank you. Bye-bye, everyone.
Thank you.